Thanks, Adrian and Ray, for inviting me to talk. And I don't have I want credit. I did bring a tie. I just forgot to put it on. So I'm just trying to bring my adrenaline level down a little bit after Sherry's talk. I almost want to go sign up right away, but not sure. Anyhow, I'm going to talk to you about where do I start, what do I need? And you may find that what I put up there seems a bit overwhelming, and there are a lot of things to consider. I'm going to talk more about, as Sherry mentioned, a focus trip. I'm going to talk about my experience teaching laparoscopy, and in particular laparoscopic cholecystectomy in developing countries, mostly in Central America, but elsewhere as well. Like everyone else, I started at 501c3, and while I think it was a good experience, it's not for everyone. There are a lot of issues to consider if you're going to take on these trips by yourself. I would recommend that you start by joining an organization that already has the infrastructure. So the lessons that I'm going to pass on from today are the ones I learned starting with my own NGO in 1994 and then moving to SAGES and the Go Global initiative. I don't have any disclosures. It's probably worth repeating that one of the greatest challenges today is to find a way to provide adequate surgical care to most of the world's population. So where surgeons may have felt, as Adrian mentioned before, a bit marginalized some 10 or 15 years ago, today we're on the forefront of world healthcare. So I could just show you the slide and then quit, because this is kind of the summary slide. It seems kind of busy, but I want to show you that a successful, safe, and self-sustaining result, both for the patients, for the people who are inviting you, and for yourself, requires this circle of key steps. And not every one of these steps will apply in every situation. I'm just going to basically just lead you through them very quickly. So the first thing is to identify a site that fits what you're trying to do. And that, just like in screening your patients, is probably the most important thing. If you're going to teach hernias in a place where there are no hernias, it's not going to work. Teaching laparoscopy, if you walk in an OR and there's a bucket of surgical instruments on the floor and all the anesthesia they have is spinal anesthesia, as I've seen in some rural areas in China, you can't teach laparoscopy there. So identifying the site, and I would say performing a site visit. This could be yourself, could be the organization, but if you don't go down, put boots on the ground, so to speak, look people in the eye, tour the hospital, and see what's actually going on, you're going to have no idea of what awaits you. Of course, you do need a local champion. In resource-poor countries, this requires additional effort, non-compensated effort from at least one individual in that area. Of course, you do need administrative support and backing. It's great if you can partner with Rotary or the Lions Club or other NGOs. When I started off in Nicaragua in 1994, over the 8-year period I worked there, we brought down 11 towers and trained 33 surgeons with no money whatsoever. It was all self-paid. Now in SAGES Go Global, we are out of the equipment business. I think economies have evolved to the point where most countries with a little prodding can come up with the equipment, and getting into the equipment business is a murky scenario. So that's not to discourage you entirely from it, but you have to look at it with a bit of a jaundiced eye. You definitely want to bring validated methods of training. You want to measure what you do. So going down with an open heart, enthusiastic mind is not enough. You have to actually measure what you do, make sure you're making a difference, and of course establish those long-term relationships. Let's just walk through these. So identifying the potential sites. SAGES Go Global has probably spent most of its time working on this process, the site visit. And I'm just showing you here a small snippet. On the bottom left, you see the sheet that the sites who apply, whether it's through personal contacts or seeing on the internet, usually it's through a personal contact. We have them answer a series of questions to see, are you even in the ballpark of what we're trying to do? It could be laparoscopy, it could be a hernia repair, could be advanced laparoscopy in some cases, could be ATLS. After these applications are received, then the team reviews them and scores them with multiple reviewers, and that's what you see on the upper right. And you know, sometimes people write to you and say, you know, we want to do, you know, advanced breast cancer care. Well, maybe that's not what you're providing. So you want to make sure there's a fit. This is even before you visit the site. So the screening is very important. It's also very important to do this screening in as objective way as possible. This is where conflicts of interest can easily arise. Your friend in country X wants you to come and teach there, and so you really have to have an open, transparent way of reviewing the areas you're going to go. The site visit, this has always been my favorite thing. I mean, I like to operate, but to me, I like discovering. I'm very curious. So to me, landing in a place I've never been before with a clipboard and a little truck waiting for me outside is one of the most fun things. It's about a 2-day process. You have to have good people skills. You have to be curious. And basically, you meet the people, assess their personalities, assess the sort of hierarchy. You want to tour the hospital. You want to look at every part of the hospital that's relevant, in particular, equipment, storage. You want to meet the people who are important, inspect the endoscopy suite, discuss processes. Ask them about local support. Is this an area in rural China there is no government insurance? Is this a centralized healthcare system in a post-Soviet country? Is this a mixed private and so you really have to assess what is the context in which you're providing care, and of course use a checklist because. So you see at the bottom left, for example, this is after day 2, site visit in China. So after we've talked, we all sit down together and we walk through that checklist. You know, and we make sure everybody understands the question, the answer, and this avoids, again, the sort of interpersonal conflicts of interest. Second, you want to deliver a package course. You don't want to wing it. You want to be clear before you go down what you're going to do. And I should have mentioned, I'm talking about teaching courses now. Service-based courses have a lot of the same issues, but I'm not talking about a service-based course where you're going down to operate. I'm talking about a course where you're going down to teach people to operate. And so you want to bring down a package course. Societies like SAGES, the ACS, orthopedic societies, OBGYN, they have standards and guidelines. You want to bring those down. You want to use validating training methods if they exist, such as FLS, or similar ones to FLS. You can build on these and make sure there is if you have the opportunity to do some pre-course evaluation of skills, that will really help you to see the impact you're making. Surgeons who have never done laparoscopic surgery, they should not walk in the OR on day 1 of the course. They will have no manual skills in terms of, so here, you know, the high ground would be to have a fully functioning animal lab. And I have set those up, but I wouldn't recommend it. It's a lot of work, very difficult. So maybe you would go for inanimate training. Maybe you can bring down a laptop with some VR training, but some sort of pre-OR training in manual skills is very, very useful. Also, it allows you to tell people where they stand in their skill level compared to other countries and the United States. Ensuring the basic equipment and supplies, this can be the Achilles heel of a program. Obviously, if there is no equipment and no supplies, you can't do what you're trying to do. I'm speaking about laparoscopy, so, and this is particularly important. I would say strive to get local or national purchase of the equipment. So you commit to bringing the know-how, your energy, the structure, and push for, ideally at a national level, like Ray has done in Mongolia, to be able to purchase the equipment, but even at a local level that can be done. In certain situations, you might decide to bring the equipment yourself. As has been mentioned before, there are a lot of companies that are willing to donate used equipment, equipment change out in hospitals. We've been able to find a lot of equipment. I am now out of the equipment business because the issues with storage, transportation, customs, theft, maintenance are enormous. And if you bring the equipment, it's kind of on you. Nursing involvement is absolutely key because in most places, equipment and supplies are managed by nursing. So this is not a doctor-to-doctor course. That's kind of a prescription for failure. because doctors only work as well as the system that they are in, and usually things such as equipment and supplies are managed by nursing. Measure the clinical outcomes. We were fortunate in my work in Nicaragua to find a young woman who was doing her master's in public health, and she was able to get funding to go down, and for 3 months she dug through records and was able to give us a nice lap versus open comparison of the results that showed that the bowel duct injury rates were no different. They were extremely low. They were within US standards. The complication rates were low. Hospital stays dropped from 4 days to 1 day. And this is the sort of thing that not only validates your course for you and the local folks, but helps you raise money. Because people want to know what is the actual impact you're having. They don't want to know how hard you're trying. They want to know, are you making a difference? And then finally, I would say definitely partner with other groups, whether it be local charitable groups. The Rotary can be an enormous asset in terms of moving equipment, storing it, actually being responsible for it. Collaborate with other professional groups, definitely. Nursing, AORN, the ACS, biomedical engineering groups. And seek endorsement from professional societies. With my 501c3, we were able to get SAGES to endorse our training program, and so the program had the SAGES logo on it. We got the AAGL, the Association of Gynecological Laparoscopists, to endorse the OBGYN program. These endorsements mean a lot to the people you are training. And of course, establish long-term relationships. One course is not going to do it. You need to return, I would say, within 3 months or less to make sure that things are on track. Make sure you do a repeat set of cases and maybe focus on, what do I do if there's a trocar site bleed, the suction breaks, you get a liver lac. I'm talking about cholecystectomy in this case. Things you might not have addressed in the first course in depth, how to get out of trouble. Trust is a very, very important factor in terms of other people's motivation to bring you back, to support you, to pay for the hotel and the food if you're there, and of course to seek eventual government recognition and support. That probably is ultimately what is going to seal the fate of what you do in the long term. Ray was able to obtain that rather early on in Mongolia, and I think that really set the ground for a nationally successful project. In Nicaragua, that support really never occurred until years after the program. And what I mean by that is that the Ministry of Health did not approve laparoscopy as an approved procedure in that country until years after our program finished, which means that half the sites stopped doing it. Eventually, you can only swim uphill so far if the government won't buy you supplies, won't buy you a new light bulb. This is very important. And then finally, of course, the goal of this is to establish personal and professional links between people and institutions in different countries, and for the individuals who are teaching as well as those who are training to harmonize humanitarian goals, to practice one's professional, and to pursue one's professional interests. So I'm going to be the short talk today, and thank you very much.